John, good to speak with you again.
You too, PJ.
Over the weekend, it emerged that there are over 40 confirmed cases of this Indian variant in this country now. Now, I know there's more than one, and I don't want to overcomplicate it, but you've been doing quite a lot of work on your channel about the worry of the variants in India. Should we be concerned at the levels?
Well, I'm afraid there is cause for concern, actually, PJ, on this one, because in England at the moment, we've got over 1,300 officially confirmed cases. And the variant we're worried about is this B1617.2. So there's three of them. There's the original B1617, then there's the point 1, point 2, and point 3, and it's the point 2 one which seems to be most transmissible. Now, the reason I was first concerned about this is it's good 4 or 5 weeks ago now. Basically, I saw what it was doing to India. So I know that India took quite a lot of precautions in the first wave back in 2020, and they fared reasonably well. And then when they liberated the precautions and things were freer again, the numbers stayed fairly low. But then all of a sudden they started going up. And that's what made me think this probably had a biological cause. So yes, there was religious festivals. Yes, there was political festivals. People staying 20 to a room in religious festivals. They were all factors. But that happens every year in India. These religious festivals are routine. So I suspected there was a biological cause. That's why I was worried about it. But unfortunately, flights from India to the United States, Europe, all over were only stopped at a very late stage. In fact, they're not stopped now. They just have hotel quarantine. I'm not quite sure what you're doing in Ireland. But
well, we have no direct flights from India, but we do have India now on the quarantine list, yeah.
Yeah. So, but again, it's bolting the door after the horse is bolted, really. It's been typical of the lack of proactivity there's been. So we react to situations rather than anticipate it. This variant now is probably in about 44 countries, unfortunately, and Ireland is one of them and other European countries. And the problem is it's growing very quickly. So we have this exponential growth where it starts off small, but then it grows very quickly. And it seems the doubling time in the UK, well, in England particularly, actually, at the moment, is about 7 days. So basically, we have twice as many as we did 7 days ago. Now, at the moment, it's in clusters. There's about 40 clusters around about the UK. And it's now confirmed. We now know that this India variant is spreading more quickly than, say, the UK variant, the B117, which is the current prevalent variant in Ireland and in the UK.
And initially, John, our concern with the British variant, to give it that name, was its transmissibility. Are you saying that the Indian one is even more transmissible again?
Yes, that's exactly what we're saying. So the UK Kent variant was more transmissible than the previous variant. Therefore, it outcompeted it. Therefore, it became the dominant variant. This Indian variant is more transmissible again, so even more transmissible than the B117 Kent UK variant. This is the concern. So it looks like this India variant will become, it's likely now that this will become the predominant variant, because this is simple evolution, PJ. It's the survival of the fittest, and this is reproducing and spreading more readily than the other variants, so it will outcompete the other variants. Now, there is good news here. The good news is that the vaccines that we have do seem to be protecting against severe disease, hospitalizations, and therefore, we would assume, deaths. The vaccines that we have now are going to reduce the transmissibility of the India variant somewhat, but not reduce the transmissibility as much as, for example, the UK variant. So we are probably going to get more spread, even amongst vaccinated people, unfortunately. And it may also, people that have been vaccinated may get mild disease with the India variant, but they're very unlikely to get severe disease. So this is kind of, it's a mix of good news and bad news. And of course, for example, I'm fortunate now. I've had 2 doses of vaccine, and I believe, are you on 1 now or 2 doses?
I've had 1 myself.
You've had 1, yeah.
A lot of my colleagues have had 1 as well.
Yeah. So if I've got another week to go. I've only had it for a week. We have to wait for a good 2 weeks after the second dose. But you do have some immunity now. But if I were to get the India variant, say in 3 weeks' time, and got mild disease, that will give me a bit of an immune boost. So the key thing is that we need people vaccinated in the communities. Now, the UK government has just made quite a major change. We've gone from 12 weeks in between the primer dose and the booster dose of the vaccine down to 8 weeks in the over 50s. Now, the reason that we've done that is, of course, the older you are, the greater you are at risk. So the over 50s are at greater risk. And because, reading between the lines, I think the government in the UK is expecting this India variant to spread around the country, perhaps fairly quickly now. And in a sense, that's bad, but in a sense, it doesn't matter too much, as long as it doesn't make people sick and kill us. So they are giving people the extra protection that the second vaccine offers at an earlier stage, so that more people will have the second vaccine.
Well, they're still on Pfizer and Moderna, John, here, they're still on 4 weeks. And the second dose is still 4 weeks away. They looked at maybe extending it, but they haven't made a decision in that just yet. Analysing our data, which I've been doing for my listeners, in terms of the daily case numbers that we have now. So if you take, say, last Friday, we had 400 and something cases, but over 80% of those cases are in the age cohort below 45. And the median within that is 28. So it's very young people mostly are getting affected with new cases at the moment because of the way our vaccine program is working. Would you be concerned for those younger cohorts spreading the Indian variant around the country?
Well, I think that's exactly what's going to happen. Older people that have been vaccinated will still be transmissible to some extent, but much less than people that aren't vaccinated. So the younger group that aren't vaccinated, now in England, Scotland, Wales, Northern Ireland, that's going to be under 40s primarily. So we're vaccinating 38, 39, 40-year-olds now. But of course, there's a big delay. So people in the 50s now are still waiting the 3 weeks before they get any effect, any benefit from the vaccine kicking in at all.
Is there a case to be made for, and this was a big discussion point politically here a week or two ago, is there a case to be made for starting now at the other end and working up? So working down from the older people and maybe starting in with the 18, 19, 20-year-olds, particularly with something like Johnson & Johnson that's just one injection, and trying to bring the two together. Is there a case to be made for that?
Yes, there is, and some countries have gone that way. And in fact, there's a bit of a tendency towards that now in the UK. So in England now, they're transferring more vaccine supplies to places like Bolton to vaccinate particularly people that are at risk. Now, at the moment, we're still vaccinating according to age categories. But other countries, for example, the Philippines, Indonesia as well, I think, that they've said, well, no, we're not, and China have done this. We're not looking so much at who's most at risk. What we want to do is vaccinate those that are doing most of the transmission so that we can get this pandemic over quickly. So there's two views there. So Ireland and the UK at the moment are both taking the age stratified approach, protecting the most vulnerable. But because they're now partly protected, it's the younger age group that are going to be spreading this around. Now, I don't know what the regulations are like in Ireland at the moment. We're having a major opening up in England, for example. So it's absolutely guaranteed there's going to be an increase in cases.
We've started opening up. We're at an early stage. As of the 17th, today, we have retail returning. We have a bit more movement. We still don't have hospitality open, except for takeaway. We're supposed to go to outdoor dining and outdoor pubs on the 7th of June and hotels opening on the 2nd of June. That seems to be the plan at the moment. Would you be wary with the Indian variant spreading?
Well, the SAGE committee, the Scientific Advisory Group for Emergencies in the UK, have clearly said that the virus is spreading with the current restrictions. So when there's opening up on the 17th of May in England and then the 21st of June, there will be more spread. And they put levels of certainty on how sure they are about these predictions. And for that one, they've put it down as high certainty, that they are sure this is going to happen. Now, what's the sort of vaccination status like, PJ, in the moment in Ireland generally?
About 2 million doses, or slightly over 2 million doses given out, and around about 30% of the adult population down into the groups of the mid-60s, and now they're in the 50s vaccinated.
Yeah, because obviously the fewer people that are vaccinated, the more people are going to get sick from this variant. Now, so far, there's no evidence that it's making people sicker. But of course, if you get many people getting ill at the same time and still only say 4, 5, 6% of them need hospitalized, that could put significant strain on the health services, even if it's not more pathogenic, even if it's not making people iller. And so far, that does appear to be the case. So what I'm really worried about, and of course, India is the perfect example of this. You know, India has actually given a first dose of its vaccine to only about 10, 11% of the population, and only about 3.5, 4% are fully vaccinated. Therefore, the many people are prone to this. Many people are prone to getting sick from this new variant, and they are. And they're all getting sick at the same time. Therefore, they can't get into hospital. Therefore, people are dying through simple lack of oxygen. Now, I'm not saying this is going to happen in Ireland or the UK. I don't believe it is. But it seems to me, unfortunately, inevitable that the India variant is going to increase in prevalence in Ireland. That means the overall case numbers will go up. So the overall case numbers, the overall numbers of people getting positive diagnosis is going to go up, driven by the more transmissible India variant, and a proportion of those are still going to get sick. Therefore, unfortunately, and I really hope I'm wrong, but unfortunately, I do see hospitalizations going up in countries like Ireland, where vaccination is not at the numbers we would like it to be.
And if you were advising our leaders in terms of what they should do with the vaccinations, would you be suggesting get started on the young folk?
You need to look at where there is most transmission going on. If they can identify particular age groups or particular activities that are infection drivers, then there is an argument for targeting those. Now, whether you target them with vaccination or whether you target them with non-pharmacological interventions like hands, face, space and ventilate, is really up for debate. I think there's a couple of important things to mention. That the vitamin D thing, Ireland is doing very well on that, way ahead of England on that. Delighted to see the reports on that in Ireland.
I think we've all been taking more, John, since I spoke to you on the programme a couple of weeks ago.
I think you've done a great job there, PJ, and that will make a difference. I believe the evidence suggests that people that would have got severely ill might get mildly ill, or people that will get mildly ill will get very mildly ill, or even be asymptomatic as a result of that. And of course, the other thing, it's summer now. Well, okay, it's not that warm here now, but open the doors, open the windows. You know, ventilation is key, and these things can offset the increased transmissibility of this India variant. But we are unfortunately dealing with a different biological specimen at the moment. That is my concern. So unfortunately, all these countries with reduced vaccines, we are going to see, I believe we're going to see increasing cases and some hospitalizations.
Finally, you did some more work recently. We talked about it before on ivermectin. Still
Yes.
a lot of resistance to actually rolling it out.
There is, and it's a very complicated one. We have to be very careful, you and me, that we don't advise people to take medicines. This is for information.
Like we said before, we want nobody taking their dog's worming tablets. You know?
No, absolutely not. But there are human doses of ivermectin available. It's on the WHO list of essential medications. In 2015, I think it was, the discoverers of ivermectin were given the Nobel Prize. This has been a world-changing drug for treating parasitic infections. But now there is pretty good evidence, and I'm actually convinced by the evidence, that it has antiviral properties. Now, there's an accumulation of evidence that ivermectin is preventing COVID-19 and is treating COVID-19. So, for example, Goa are using this as a preventative now. The state of Goa in India. I've talked to Indian doctors, and they're finding it efficacious in the early stages of the disease. But I've talked to Dr. Pierre Corey in the States. He's found it efficacious in later stages of the disease. I've talked to Dr. Tess Laurie, who's done sophisticated meta-analysis that I don't pretend to understand on this. And when people of this caliber are saying, look, there is something here, we believe this is working, then it's not for me to say it's working or not. I'm just a YouTube commentator and a retired nurse lecturer. But I think there is sufficient evidence, like the Irish government has done with vitamin D, for chief medical officers and governments to say, look, this evidence for ivermectin, we don't accept it. but stand up and say that publicly, or say, look, there's evidence for ivermectin here, we're accepting this. Because people always say they want large-scale randomized clinical trials. Well, of course we do. But we don't have randomized clinical trials on the efficacy of parachutes in people falling out of aeroplanes. We don't have randomized controlled trial on blood gushing out of femoral arteries in accident emergency departments, but we still know you've got to stop the bleeding. We can't have clinical trials on everything. And of course, clinical trials are expensive, and there's not a lot of financial motivation really to do this on ivermectin, because it's now a generic drug. This basically costs nothing, PJ. It's cheaper than it's as cheap as paracetamol. It's very, very cheap. The problem, I think, is that people that want to promote vaccines, rightly, because this is the way out of the pandemic, think if we have ivermectin, people won't take the vaccines. But heck, I want every tool I can get. I want vaccination, and I want to treat people that are ill, and I want a short-term prophylaxis as well if I can get it. So what I would just say to conclude on that is I think there's enough evidence been presented that governments need to pronounce on this, yes or no. And the ball is really in their courts. And I think for governments not to pronounce on this now is unacceptable, because the evidence is sufficient to ask the question in clear, loud terms.
John, it's always a pleasure to have you on The Opinion Line. Thank you once again.
PJ, pleasure.